Hey guys, it's Marshall and Mike with PhysioU, and today for the Mentoring Minute, we're going to be talking about adductor strains or groin strains. Looking through the research, the biggest population that has them is ice hockey players and soccer players, with six injuries per every 1,000 player games in soccer and about 3 injuries for every 1,000 player games in ice hockey. When you look more into the research as far as why they happen, the biggest predictor is a previous injury. The number one predictor is previous injury. The second predictor is the amount of training in the off season. What they found is less than 18 sessions of training, less than 18 meaning you had 3 times higher risk of injury. So the more you're training in the off season, the less likely you are to injure your groin, is what the research shows. When they looked at when it occurs in season, majority of them occurred in training camp, followed by regular season, and then least likely to occur in the playoffs. 62% of them were in the adductor longus, and 90% of them being non-contact. And what Tyler et al. Found was that if the hip abductors were stronger than the hip adductors, or if I said it the other way around, if the adductors were not stronger than the abductors, there was a 17 times greater risk of injury. So we want the adductors to be stronger than the abductors. When we talk about assessment or screening for adductor strains, there's a couple of key components we want to look at. One is adductor length, so looking at hip abduction, which is the length of the adductors, looking for reproduction of symptoms. We can also look at what's called the squeeze test, so having them try to squeeze his heels together, looking for a reproduction of symptoms. If that doesn't bring it on, this isometric contraction here, we can also check that same contraction at a different range. So go ahead and bring your heel towards your other heel, look and see if that brings on reproduction of symptoms. In screening tests done before season to look to see who's at risk for it, they looked at 2 things. One, they looked at is eccentric adductor strength. So go ahead and lay on your right side facing me. And we're going to put this leg here. Good. Straighten this knee. And you're going to lift this leg up. All right. So hold that there. Right. And don't let me push you down. So looking at strength of the adductors eccentrically. And the second thing is looking at abductor strength ratio. So we get a number for how strong his adductors are. And now flip on your other side. And then we'll look here at abductors. So roll the trunk forward, bring the leg back, roll forward a little bit. Good. Then hold strong, hold strong. And then getting the number for strength here. Okay. And what research shows is that there should be a greater ratio of adductor strength compared to abductor strength. And if there isn't, if there's not at least a 17% greater strength here, that's a high risk for adductor injuries. So that wraps up the Mentoring Minute for screening for adductors. Again, we're looking at adductor length, eccentric adductor strength. We're looking at ratio of hip abductors to adductors, as well as we're kind of making sure, well, what sports are these people playing that have the highest risks for them, and making sure during the off season that there's training, because preseason was the most common time that they injured this. Make sure you guys stay tuned next time. We'll talk about more interventions related to hip adductor strains prevention. Take care, guys.